You swallow your morning blood pressure pill with a glass of water, wait an hour, and sit down with your monitor. The cuff inflates, squeezes your arm tight, and hisses as it deflates. You look at the screen, expecting a reward for your discipline, but it still flashes 148/86. A deep, heavy frustration sets in. You are doing what you were told. You are walking 30 minutes a day. You cut back on the salt. You are taking the medication. But the numbers refuse to budge. Your doctor smiles, writes a prescription for a second medication, and tells you to keep walking. But here is the biological truth that the standard 15-minute clinical visit completely glosses over. Walking is fantastic for your heart muscle, but standard, dynamic cardiovascular exercise is often not enough to penetrate the microscopic, structural stiffness of an aging vascular system. Today, we are going to look at a highly specific, scientifically validated daily habit that takes exactly 10 minutes to perform. It does not require a gym, it does not require you to break a sweat, and you do it sitting in your favorite chair. But to understand why this 10-minute habit works better than some prescription medications, we have to look deep inside the walls of your arteries and decode the exact mechanical trigger your body is missing. Your blood vessels are not just dumb, hollow pipes carrying blood from point A to point B. The inner lining of every single artery in your body is covered by a microscopic, single layer of cells called the endothelium. The endothelium is arguably the most important organ in your cardiovascular system because it is the manufacturing plant for a miracle molecule called nitric oxide. Nitric oxide is a gas that acts as a biological command signal. The moment it is produced, it sinks into the smooth muscle of your artery walls and forces them to physically relax and widen. When you are 20 years old, your endothelium is incredibly sensitive. You go for a jog, your blood flow increases, and the endothelium instantly floods your system with nitric oxide, keeping your blood pressure perfectly stable. But as you cross the age of 60, the endothelium becomes tired, damaged by decades of sugar spikes, stress, and systemic inflammation. The manufacturing plant slows down. By the time you are 65, your natural production of nitric oxide drops by up to 50%. Your arteries stay stiff and constricted simply because the chemical signal to relax is no longer being manufactured. To lower your blood pressure, you have to force that lazy endothelium to wake up and start manufacturing nitric oxide again. Walking is great, but it produces a steady, mild increase in blood flow. To truly shock the endothelium back to life, you need to create a massive, sudden surge of biological friction. You do this through a concept called isometric exercise, specifically isometric hand grip training. Isometric means you are creating intense muscular tension without actually moving the joint. For decades, doctors told heart patients to avoid heavy lifting and gripping because it temporarily raises blood pressure during the exertion. But clinical researchers discovered something fascinating. While the pressure goes up slightly during the isometric grip, the biological aftermath once you release the grip creates a massive, sustained drop in resting blood pressure that lasts for hours, and over time, fundamentally changes the resting state of the arteries. Here is the exact 10-minute protocol, and then we will explain the intense biological cascade it triggers inside your body. You need a rolled-up hand towel or an inexpensive, soft foam hand gripper. Sit comfortably in a chair with both feet flat on the floor. Hold the towel or gripper in your right hand. You are going to squeeze it, but not with 100% of your strength. You want to squeeze it at exactly 30% of your maximum effort. It should feel like a firm, sustained handshake. You hold that firm, unbroken squeeze for exactly 2 minutes. Then, you release the grip completely and rest your hand for 1 minute. Switch the towel to your left hand. Squeeze at 30% effort for 2 minutes. Rest for 1 minute. You repeat this cycle until you have done 4 total squeezes, 2 on each hand. 2 minutes of work, 1 minute of rest, 4 times. That is exactly 12 minutes from start to finish. It sounds almost too simple to be effective, which is why most people dismiss it. But here is the deep cardiovascular mechanics of what is happening inside your body during those 12 minutes. When you hold that sustained, 30% squeeze for 2 solid minutes, you are physically clamping down on the blood vessels inside your forearm. You are temporarily restricting the blood flow into those muscles. The muscle tissue rapidly burns through its local oxygen supply, creating a state of localized hypoxia. The tissue begins to quietly panic, sending distress signals to your brain that it is starving for oxygen and blood. This temporary restriction is the entire point of the exercise, because the magic happens the exact second you let go. When the 2 minutes are up and you completely release the towel, the physical clamp is removed. In response to the temporary oxygen starvation, your body forcefully throws open the vascular floodgates. A massive, high-velocity rush of blood violently surges back into your arm. In clinical biomechanics, this is called reactive hyperemia. As this tidal wave of blood rushes back through your arteries, it aggressively rubs against the inner walls of the vessels. This physical rubbing creates what is known as shear stress. Shear stress is the ultimate biological trigger for your cardiovascular system. When those lazy endothelial cells feel that high-velocity friction, they are forced to instantly wake up. The shear stress physically commands the endothelium to dump a massive dose of nitric oxide directly into the bloodstream. You are essentially using the muscles in your hand as a biological pump to manually force your arteries to manufacture their own blood pressure medicine. While the physical execution of the grip takes 10 to 12 minutes, there is a massive hidden trap that most seniors fall into when trying this protocol, and it completely reverses the benefits. That trap is the Valsalva maneuver. When human beings grip something tightly, our instinct is to hold our breath and bear down. If you hold your breath while squeezing the towel for 2 minutes, you will cause a dangerous spike in the pressure inside your chest cavity, which drastically drives up your blood pressure and places severe strain on your heart valves. To make this protocol safe and effective, you must aggressively manage your breathing. As you hold the 30% grip, you must breathe deeply and rhythmically into your belly. Inhale for 4 seconds, exhale for 6 seconds. By actively controlling a long, slow exhale while maintaining the isometric grip, you are simultaneously stimulating your vagus nerve. You are creating the mechanical shear stress in your arm, while chemically keeping your nervous system in a state of absolute calm. Timing is also a critical factor in maximizing the biological return of this habit. You can do this at any time of the day, but performing this 10-minute protocol in the evening, roughly an hour before you go to sleep, offers a distinct physiological advantage. As we age, our autonomic nervous system often loses the ability to naturally drop our blood pressure during sleep, leading to a highly dangerous condition called nocturnal hypertension. By performing your isometric grip training in the evening, you are artificially inducing that massive nitric oxide dump right before you lie down. You are forcing the vascular system to open, relax, and dilate, giving your heart the protective, low-resistance environment it desperately needs to recover while you sleep. But we must address the final biochemical reality of this process. You cannot build a house without bricks, and your endothelium cannot manufacture nitric oxide out of thin air. The physical shear stress of the hand grip provides the instruction, but your diet must provide the raw materials. If your diet is completely devoid of dietary nitrates, the endothelium will try to respond to the squeeze, but it will have nothing to build the nitric oxide with. To multiply the effect of this 10-minute habit, you must consume raw, organic nitrates earlier in the day. A heavy handful of arugula in your lunch, a glass of high-quality cold-pressed beet juice, or a serving of steamed Swiss chard provides the exact chemical precursors your blood vessels require. When you combine the dietary nitrates with the mechanical shear stress of the evening hand grip, you create a perfect, synergistic loop of cardiovascular repair. You must treat this protocol with the exact same respect and consistency as a prescribed medication. You will not do this once and magically wake up with the blood pressure of a 30-year-old. The clinical trials that prove the overwhelming efficacy of isometric hand grip training measured the results over an 8-week period. It takes time for the endothelial cells to heal, for the microscopic vascular structures to remember how to expand, and for the systemic inflammation to subside. You must commit to these 12 minutes a day, 4 to 5 days a week, for 2 solid months before you judge the results on your monitor. Your heart has been beating relentlessly for every second of your life. It is fighting against stiffening arteries and a nervous system that forgot how to relax. But your biology is incredibly responsive if you give it the right mechanical inputs. Stop relying solely on the pharmacy to do the heavy lifting. Grab a towel, control your breathing, and manually force your arteries to wake up and do their job. This information is based strictly on clinical biomechanics and cardiovascular research, and it is entirely for educational purposes. It is never a replacement for your personal physician. If you have a history of severe cardiac events, uncontrolled extreme hypertension, or stroke, you must clear this isometric protocol with your doctor before beginning. Take exceptional care of your body, do the mechanical work, and your cardiovascular system will respond. I will see you in the next video.